You don't go out and just run 5 miles the first time you've ever trained. You do 1 mile and then you work yourself up. So oftentimes I'll tell my patients, let's gradually get your skin used to that retin-A. Even going to get a manicure, right? We're putting our hands in, those UV lights to cure the polish. Winter months, you can put it in your evening product if you want for a little bit more correction.
Welcome to Derm-It Trotter. Don't swear about skincare, where host Dr. Shannon C. Trotter, a board-certified dermatologist, sits down with fellow dermatologists and skincare experts to separate fact from fiction and simplify skincare. Let's get started.
Welcome to the Derm-It Trotter Don't Swear About Skincare podcast. I'm excited today because we're entering my favorite season, fall, and we're going to talk with Raquel Merlini. She's a registered nurse and certified aesthetic nurse specialist with over 14 years in plastics industry, and she's the owner of Our Skin Aesthetics. She's a former pro bodybuilder, pretty impressive here, a triathlete and personal trainer. She's going to put us all to shame. But what she really understands that's important is that connection between confidence and well-being. And I'm really happy to have her here because she's going to talk about fall skincare, what we all should be doing to take better care of our skin this fall. So welcome to the podcast, Raquel.
Thank you so much for having me. And I agree with you. Fall is like one of my favorite times of the year. I love everything pumpkin. So definitely. And I'm here in Michigan. And so our leaves are beginning to change and we're getting that Indian summer. So fall is definitely a great time of year. And it's a great time of year to, I like to say, fall cleanup for your skin.
Fantastic. Because I think a lot of people always think about the spring cleaning aspect of what are we going to do for skincare? What do we look at product wise? What should we be doing or how should we adjust things? So I wanted to talk about like, why do you feel like there's a need to make a change in your skincare routine just because it happens to be fall?
Yes. So, I mean, the seasons change, weather changes. I think it's very important, dependent upon your location geographically. So, I know here in Michigan, our heat turns on, skin starts to lose that humidity factor, and you get dry. A lot of chapped skin. Seasonal dryness, allergies, also taking allergy medications that people oftentimes forget will also contribute to skin change. So I think it's definitely important that we don't want to weaken that skin barrier and we want to make sure that we're not accelerating that moisture loss. We want to lock that moisture into the skin.
And you mentioned even before that, like a great time to maybe do a little cleanup. So I'm sure a lot of us are bothered by the leaves that fall every year and the amount of raking we're doing and getting things sort of ready as we transition into winter, especially in the Midwest. When you talk skincare cleanup, what do you recommend people should be doing? Like expiration dates or certain things you're like, hey, just toss it, move on to the next product. What is your recommendation for fall when it comes around on how to really get just our products back in line?
Yes, so good question. I don't necessarily think that you need to toss all of your products. I mean, I think the shelf life is quite extensive, as long as you're keeping them in that cool, dry, not exposed to light. And oftentimes, a lot of the glass bottles now that some of the serums will come in are in amber color. So it helps to protect those products. I keep mine all in a drawer so they're not even exposed to light. But when I say fall cleanup, just taking those sun screens that are a little bit more coverage, perhaps your lighter moisturizers, your serums that are going to help keep pigmentation down. Let's switch them more to maybe a ceramide or, some type of a lightening and brightening agent. So just tuck away that summer skincare and let's get into using more products such as those that are going to help prevent that dryness, that flakiness. That can possibly lead to your skin not being as hydrated as it ordinarily would be.
Yeah, it's something that I struggle with. I definitely am a gal that changes my skincare routine based on seasons. And I tell patients that because sometimes they want it to be just straightforward. I can use the same thing year round, don't need to make adjustments. And unfortunately, it's just not the way it is. Like our skin changes with the seasons, and keeping my skin well moisturized is something that I've struggled with when the weather shifts. What do you talk or recommend or talk about, with folks about what's the best way to hydrate, or is there a certain type of moisturizer that you think is better as we transition into fall and winter?
Yeah, so I think you have to definitely take your skin um what exactly your particular skin type is into consideration, right? Like, I'm over 50. So my skin, I'm dealing with some menopausal issues. Your skin's going to get a little drier, maybe a little bit more prone to cracking, irritation. So again, you want to take someone who might be younger and still having those acneic breakouts. Your skin still needs hydration, right? Not necessarily oil because you're already producing oil yourself. An older population or someone with a thinner skin may not be producing that oil, so they need a different type of moisturizer to replace that. Someone who is still maybe breaking out, but you still need hydration. So, and then that's when your treatment room, going to a professional that can put together a particular skincare routine, select the products that are going to be best suited. I'm a big Retin-A person. I think every patient should be on Retin-A. However, someone who still is having oil and acne and breakouts, maybe they need a little bit more of an aggressive or a higher strength retinol in comparison to somebody who does have a more mature skin or a drier skin, finding a lesser percentage retin-A. And then they have amazing products like We Care the Skin Better line. They've got their Alpha Ret Intense. It's buffered so that then you don't go through the peeling process either, that oftentimes frustrates patients. I mean, I'm sure being in this profession and being a physician, that your patients come in and oftentimes will see the most. When a patient tends to be non-compliant, it's not that they don't want to do the treatment, but when your skin's going through a period where it is flaking or it's irritated because of that particular retin-A,
Mm-hmm.
you don't want them to get frustrated. And then also explaining to them the layering process, right? Like, I'm sure you share with your patients. When I speak to my patient about a retin-A, it's again, like we mentioned about doing triathlons earlier. You don't go out and just run 5 miles the first time you've ever trained. You do 1 mile and then you work yourself up. So oftentimes I'll tell my patients, let's gradually get your skin used to that retin-A. Maybe just use it Monday, Wednesday, and Friday. I will explain to a patient, you can put a little bit in the palm of your hand, put your moisturizer. It's like, instead of having a straight vodka on the rocks, you put a little
Mm-hmm.
pineapple juice or orange juice with that vodka and dilute it a little bit.
Yeah.
So I'll have my patients mix their retin-A with their moisturizer and put it on and create their own buffered process. So I think, again, that's where seeking a professional, I think it's great to be able to go to over the counter places that retail skincare, but until you really speak with a professional and answer some certain assessment questions to figure out what the best products are for your skin, having someone put together a routine for you is, in my opinion, you're going to get your best optimal results.
Well, I love that because there are quite a few things I want to pull from what you just talked about. So, one, when you talked about, oily skin, acne prone skin, really important point that I think a lot of people don't realize that you mentioned is that acne skin, oily prone skin still needs moisture. As you mentioned, not necessarily oil, but still needs moisture because hydrated skin is healthy skin. And even if you're treating acne, somebody may not love a heavier moisture or moisturizer, one that may have an oil component to it, but they still crave that need for moisture because dried out skin
Mhm.
can definitely make their acne worse. So that's great to highlight because I do think that's a myth that some people are like, oh, I feel oily, so I'm never going to use a moisturizer, and not necessarily true. And as we move into fall with that need for hydration, how you talked a little bit about sort of looking for moisturizers that might be a little bit more deserving of that dry skin, kind of shifting away. I will recommend, kind of avoiding maybe the gel type moisturizers, really focus on those that have some
Mhm.
humectant properties, might be a little bit heavier, for patients. And then two, I love that you use mixology. Gosh, like anyone that can use mixology beyond, going out to have a cocktail, but in our skincare. But honestly, that's kind of what we're doing. And you're catering, to the patient, like what's the perfect cocktail for them, right? Their signature cocktail based on their
Mhm.
skin type and individual needs. So that's fantastic. And then we talked a lot about Retin-A. For some of the folks out there, if you're not familiar with Retin-A, that is a branded version of tretinoin, which is a form of a vitamin A, or what we call a topical retinoid. And so you'll see multiple versions, whether you have over the counter, retinol, retinal. You also have Grand Active. You have a lot of options out there over the counter that you can look at, and then prescription strength too, which you can do even adapalene over the counter prescription strength,
Mhm.
tretinoin, or even as high as tazarotene if you're really feeling kind of excited to be daring and see what happens to your skin. But I think, the point of addressing your retinoid or vitamin A is really essential, because I'm one of these people, and I don't know if you've ever done this, but I'll switch. I'll go to a lower potency or sometimes even over the
Yes.
counter during the fall and winter, because I just can't handle, the higher potency ones. Do you find that to
Mhm.
be the case too for yourself or your patients?
Yes, I agree. I tend to get a little bit more oilier myself in the summer months, so I can use my straight 0.1% retinol, or I'm sorry, Retin-A product. And then in the wintertime, I have to use a more buffered. And then I also use a heavier moisturizer. And I'll even go the extra mile sometimes and slugging, as we've heard the term. I will put my Aquaphor as a third barrier to lock that moisture in and really make it a little bit more occlusive, so that my skin really is able to absorb those products overnight. So again, I mean, we know that our skin is our largest organ, right? And it's the one that is continuously changing.
And I think you have to, like I said, it changes with the weather, like we've talked about. And
Mhm.
slugging, I do find for some people can be beneficial. And it's kind of a little bit of a test if you're acne prone. Unfortunately, some people it definitely can aggravate their acne and may not be the best option. But there are great non comedic moisturizers out there, ones that don't clog those pores up and lead potentially to acne, that you can use with your tretinoin or your topical vitamin A cream as well. So I think that's a good balance that you can offer people if they're craving that extra hydration. Because you're right, if it's too irritating, people are not going to use their topical
Mhm.
retinoid, whatever we recommend. So changing the strength or the potency, and then arming them with really good instructions on how to moisturize. And then your analogy of the marathon, that is the one I have always used. I tell people that little bit of flake or dryness is kind of like that little bit of sore muscle when you first start running, but you
Yes.
really want to minimize that. And a lot of people over time can tend to build up some tolerance. And I tell them that moisturizer is kind of like your stretching and your hydration, just to kind of help you get through up to the next level. Or sometimes we talk about that 3-2-1 rule, where you'll apply like every, 3 nights for 3 weeks, every 2 nights for a couple weeks, every one. But again, sometimes we don't always get there, especially with the weather shifting. And so we need to arm people with tools like that. Now, one of the things we've talked about, obviously, a little bit of hydration, moisturizer, a little bit. What about sunscreen? Because I think there are a lot of people that feel like, oh,
Yeah.
it's done. All right. So tossing that sunscreen when I do my fall cleanup, and then maybe they're not thinking about using sunscreen for the fall. What do you talk about with your patients about sunscreen use when the weather shifts?
Yeah, so I think that that's still very important because your UVA, or I'm sorry, your UV rays persist in fall. Still 80% penetrate clouds even. So, again, being Midwestern girls, we're going to not possibly see the sun as much, but you're still going to have that sun exposure. And then I'm sure, like yourself, I'll tell my patients too, it's not just being outdoors that's a factor, it's still indoors. It's those UVA rays above us that are aging rays that are still going to cause damage to the skin, right? So
Mhm.
I'm always a big proponent of still having some type of sunblock on. You could do a broad spectrum if you want, or you can do the mineral filters with your zinc or your titanium. The amazing thing now is the day and age that we're in. You've got your tinted moisturizers. Your makeup still has your SPF built in, so you may not need the strength required that you would being outside in the summer months or on a beach vacation. But I do believe it's still imperative that you have that sunblock on, even in the winter months.
Yeah, I think for sunscreen, it just established, healthy habits too. If you're doing it every day, regardless of season, I do think it puts it into your routine. And you're right, it really depends upon where you're at geographically, essentially in the world. But we still get a fair amount of sun exposure even during those fall and winter months. And the likelihood of burning might be a little less, except for maybe you're on those ski slopes or and you get that reflection
Yeah.
if you're in a really cold environment. But there's that cumulative factor of sun exposure adding up over our lifetimes that makes a big difference too. And then I also think you mentioned the indoor piece. Do you talk with your patients about high energy visible light? It's gotten a lot of attention now. The screens we're looking at right now or our phones,
Yeah.
especially for people with pigmentation issues or premature aging. Is that something you talk about with them as well?
I do. I mean, even I'm sure you've seen, some of the studies and discussions about even going to get a manicure, right? We're putting our hands in, those UV lights to cure the polish. And so you are still getting exposure, like you said, from, screen time as well as those external factors.
Yes, I think it's important too. And I hopefully most of the salons I know have made that shift to LED, but there are still some,
Yeah.
I understand, that are using UV. So it is one of those things that you do have to take into consideration. And especially I like to recommend if people are prone to pigmentation changes that they're using sunscreens that have iron oxides in them or tinted to really help with that high energy visible light for protection, as we're finding out more and more how it contributes to pigmentation changes as well as
Yeah.
premature aging. And speaking of pigmentation changes, I think this is what happens a lot too at the end of summer. People have been out all season and like, wait a minute, look at this brown that's now kind of coming to the surface. Maybe some
Hmm.
freckles that faded previously have become a little bit more prominent, or they've developed some lentigities, or maybe their melasma has flared. So, how do you talk with them about sort of pigmentation changes that occur, and maybe what should they be integrating into their skincare routine?
Yeah, so I'm a big proponent. I've suffered from hyperpigmentation myself. I remember I lived in Charlotte, North Carolina for a couple of years, and I was down there no longer than 30 days. And I remember rubbing my upper lip. I looked in the mirror and I was like, as I was driving, I was like, what is this? And I ended up getting that chocolate milk mustache. And I was like, oh my goodness, I wear sunblock. So I'm sure is what you explained to your patients also is heat can also trigger the pigmentation too, because your body wants to start producing those melanocytes to protect itself. So, I tell my patients all year round, they should have some type of product, whether you want to do a hydroquinone or a vitamin C to suppress those melanocytes. And as we're getting into fall, like you mentioned, again, fall cleanup, I always say we need to correct either the sins of the summer or like you earlier mentioned that cumulative sun, because we know sun damage can show up from what you did 7 years ago and you've never had that freckle or brown spot on your face prior, and now all of a sudden you're like, oh my goodness, I wore my sunblock all summer long, why do I have this litigeny or freckling going on? So that's again where I think that correction. So I like products that have vitamin C. I'll couple them with hydroquinone. Maybe summer months I like them to do it in the AM. Winter months, you can put it in your evening product if you want for a little bit more correction. But I think something that is going to have those antioxidants in for correction is definitely important. And then I'm sure we'll discuss, but then that's when you get into your chemical peels, your IPLs, your
Mhm.
Fraxels, all of those that are going to be a little bit more stronger in the correction department.
Do you counsel patients about hydroquinone sort of overuse? Because, in some areas of the world, it's kind of been, taboo to go there. I think a lot of people will come in, and you may have patients like this too. They're even afraid to potentially use it. They're looking for kojic acid, tranexamic acid,
Yes.
some of these other options. Do you use a combination of those or educate them on sort of the right way to use hydroquinone if you think it's appropriate?
Yes. So I do love, I'm a little old school. I like the 6 week cycle of
Hmm.
it. And then, yes, I do love the tranexamic product, as well as azelaic acid, for those that want to go a little bit more natural. We use the kojic berry, or kojic acid, every microneedling treatment. It's one of the add-ons that we just complimentary throw on because I love the way that it does lighten and brighten the skin. So I think that there are other avenues to be able to use as well. So I think, again, it just depends what's the level of pigmentation. When I'm getting into my IPL season, I do like my patients to be on a little bit more of an aggressive product to really lighten that skin, because I think that people are under the misconception, oh, I haven't been in the sun for a month. Okay, that's fine. Maybe you haven't been directly exposed by the sun, but you still possibly could have some color or pigmentation left to your skin, right?
Mhm.
And I don't want to get caught where we have a burn situation or anything else like that. So I like to aggressively lighten up the skin a little prior, possibly even with a Jesner or a chemical peel, to help get that skin in line before we go ahead and use a different modality.
And it kind of is a good segue into talking about chemical peels or more in-office procedures for kind of lightening and brightening. Is that something you jump to right away, or you wait to see what topicals do? Or are you looking at kind of the severity of pigmentation to talk more with patients about that as an option?
Yes, I think, again, it's going through that assessment, understanding what the patient's goal is, length of time, too, I think is really important. Meaning, do they have a couple of months to be able to get their skin conditioned, or is it something that, okay, we have an event at Christmas time and I need to be able to get in these treatments before I'm gonna be a snowbird and go out of town. So, I think every patient is individual. Each circumstance should be geared towards patient specific and understanding what it is that those patients' needs are. And again, like you mentioned, I love combining different modalities and different treatments. And, what we might have done the year prior or past with my patient, it may change for this particular season as well.
Wow. So what we talked about, I think, has really probably got people excited that fall skincare can still be a good thing. Doesn't have to be boring. Maybe not as fun as summer because the weather is shifting. But between hydration, adjusting the routines, really catering it to the individual, what other tips or tricks do you have to offer? As the weather changes, do you have any of your like favorite tips you'd love to share with patients as well?
Oh my goodness. I get so excited about skincare. I mean, I know I'm behind the chair injecting the majority of the days, and I was a licensed esthetician before I became a nurse. So I had many years in skincare. And I oftentimes feel that if you're doing good skincare both in a treatment room as well as at home, it just makes anything else we do with injectables look better, even when you segue into if you're looking for a more surgical route.
Hmm.
To answer your question on what my favorite treatment, I'm always still a big fan of microneedling, which is seasonless, but I just don't think that you can go wrong with microneedling. I think another nice treatment is you can stack on, you can do an IPL, maybe target some of those certain brown spots if you don't have all over browns.
Hmm.
And then you can still layer a microneedling treatment over top. I've been doing the CO2 laser for patients for many, many years. I just had one myself last February. I'm a big, that's probably a really exciting part for me in aesthetics, because that laser can be so life changing with those ritids around the mouth, the ones underneath your eyes, neck. A lot of people want to, forget about the neck.
Hmm.
And, I think it's really important to consider face, neck, and chest. And the older too, a lot of people are taking care of there's so much knowledge that's available, and they are taking care of this up, but then they even forget to do their hands. So, I don't know, Dr. Trotter, Shannon, I don't know if I could really give you one
That's
specific one.
okay.
I just get so
It's hard to
excited.
nail it down sometimes, but
I
I think what
know.
you pointed out that I want our listeners to understand is your point that you need to see a professional, somebody that deals with skincare can help make the assessment, has that experience. And there are a wide variety of options to do that. As you mentioned, like sometimes people have gone to an esthetician, sometimes they've gone to their nurse, sometimes they've gone obviously to their physician. So, and then we have obviously nurse practitioners and physician assistants in the space too, but making sure they're professionally addressed so that they make good choices about their skincare to avoid complications like, contact dermatitis, allergy, making things worse before we actually make them better. So I think that's probably one of the best things too to pull from kind of your story and your experience today, is to really let listeners out there know that you don't have to do it on your own. Although we are a do it yourself kind of a country on all kinds of things, that's okay maybe for the house, but we tell people for your skin, let a professional kind of help you through that process as well. So I think that that's really important, because there's a lot of us in that skincare sandbox, as we like to call it, for sure.
Yes. Yeah, I'm sure you have some thoughts on that. I know that there was some crazy stuff during COVID because unfortunately we didn't have, access to some of the when everything was closed down, right? And
Mhm.
the DIY, like the rollers and, I just tell my patients, some of those things are great. I love gua shu. I think you're stimulating, blood supply, blood flow to the skin. You're going to help relax some of that fascia. A derma roller is great too, as long as you're not pulling and tugging on the skin too much. But, the microneedling do it yourself rollers and stuff, you're just causing more trauma to the skin. So again, seek a professional. I think some things, you can get off of the internet, and if you want to go the TikTok route or social media, I'm not gonna bash on that because I do think there is some good information, but there's also some very frightening information as well. So
True.
seek a professional.
Exactly. Well, speaking of that, if our listeners want to try to find you, can you let them know where they can locate you online or your social media handles?
Yeah, so we're located in Birmingham, Michigan. My website is rskin, so the letter R, skin, skin.net. And then my personal Instagram is rskinadmission. And then our office and business one is rskin aesthetics.
Thank you for sharing. So if you want to check out Raquel, you know where to find her. And I want to thank you for coming on the podcast and giving everyone some tips for that fall skincare, because we're all going to need them as the weather here starts to shift. And we're going to
Yes.
enjoy those pumpkin spice lattes. So some good
Yes.
skincare along with it is perfect. But thanks again for coming on the podcast.
Thank you so much for having me. It's an honor, and I love following you and all of your information.
Thank you. Thank you. And if you like what you heard here today, please click like and subscribe. And thank you so much for listening to Derm-It Trotter. Don't swear about skincare. And I look forward to joining you on the next episode.
Thanks for listening to Derm-It Trotter. For more about skincare, visit dermittrotter.com. Don't forget to subscribe, leave a review, and share this podcast with anyone who needs a little skincare sanity. Until next time, stay skin smart.